I'm Dr. Sharon Saline, and this is our weekly Facebook Live on Attitude Magazine. This was started in an effort to reach and support people during the pandemic, and it's taken a life of its own as we've become our Friday afternoon community. I want to encourage you to check out my website, drsharonsaline.com. So let's get started and let's look at what is challenging about sharing your feelings and how we can do a job a little bit more effectively and productively. So one of the things that helps, what the question that I asked if you're just joining is what leads you to share your feelings inappropriately? Finding or losing my words, that can be very frustrating. Claudia from Burbank, you have trouble with containment. Margot Shannon from Australia, hi there. Harlan, hey, nice to see you. Julie, helping my son manage his frustration and sharing specifically in school how he feels when he feels frustrated. Okay, so we have two categories of frustrations today. We have adults and we have kids. And I'm going to try to address those separately because they're different. Liz Brady, Michigan, when I'm feeling hyper and I can't calm it down in an appropriate way. Got it. Ajit, awesome. Always good to be back. Nice to have you, Ajit, and from the UK. And being able to determine what emotion I'm feeling is my question. So I'm going to take some notes because these are really important, and sometimes Facebook gets rid of it. So what I have is containment. I have putting words to feelings, and I think there was something else that was that I wanted to get. And then for kids, frustration and how to express it. Sorry, these are really great, and I want to make sure I get to all of them. Let's see, finding or losing words. Okay. All right, so let's get started. I'm going to dig in, and I'll start with those, and then I'll get to some of these others later. Okay. So if we're going to talk about how to stop bottling up our feelings and how to share them appropriately, I would like all of us together to take a deep breath. So breathe in and breathe out. Put your hand on your chest and breathe in a favorite color. And breathe out. And one more time. Breathe in. Breathe out. I'm breathing in a beautiful sea blue. I don't know what color you're breathing in, but being able to breathe in a color when we're agitated, I'm a little bit excited and maybe even a little nervous to talk about this topic, so it helps me settle. And that's one of the first things that we want to talk about, because when we are activated, when we're in our reptilian and our emotional brain, so the back of our brain and the middle of our brain, our thinking brain basically is checked out and gone to the Bahamas. And so what's driving us are our basic instincts and the amygdala, the seat of fight, flight, or freeze. And that usually isn't a good sign in terms of how we're going to express our feelings, because we need our thinking brain, our prefrontal cortex, to stay online to help modulate those reflexive responses, increased heart rate, higher blood pressure, that racing feeling, and that incredible rush of adrenaline from the amygdala when we're activated. So we want to settle down, and we want to practice what it feels like to be calm in moments that are not high voltage, so that we know when we're in a high voltage what it feels like to feel settled and calmer. And that's why it's really important to practice breathing before you go to bed, or when you wake up in the morning, or maybe do a meditation app, so you know what centered feels like in your body. Because it's only from this place, when we're centered and stable, that we can share our feelings in ways that other people can hear them and that are accurate to what's actually going on with us. So I want to start with some of these comments here. So what somebody said, it's hard to put my words into feelings. And that's right. It's hard for all of us to put our words into feelings because feelings and words aren't necessarily connected. We've connected them over time. And so it's helpful if you are having a feeling and you don't know what the words are that go with that, to say, I'm having some big feelings right now. I need a little time to identify what those are. Asking for time to slow down, to name your feelings, only serves you. And a lot of times, I think, particularly for people with ADHD, you feel embarrassed. Like, ugh, what's wrong with me that I don't know the word? Ugh, I can't believe I'm all upset again and I don't know how to calm myself down. That's what one of the 13-year-olds in my practice told me this week. I don't know how to calm myself down. And I said, I know that's not true because you're calm now and because we've worked on tools. It's making that choice, right? So she's activated and she's yelling at people and she's not actually expressing what's really going on. So there's a certain level not only of knowledge about which feelings go with which words, but there's an acknowledgement of vulnerability because when we're having big feelings, we are vulnerable. We're vulnerable to our emotional brain running the show. We're vulnerable to the feelings of hurt, anger, sadness. We're sometimes even vulnerable when we're joyous because we're so activated and excited that we're spilling out everywhere, and we may not be conscious of how that's affecting other people. So the first thing that I want you to do is to take some time to identify some of your feelings and write some of those words down. When my heart races, that's usually because I'm excited or I'm anxious. What's some language that you're comfortable with, and start to name some of these things. If you struggle with attaching feelings to words, there's some great things on the internet like feeling posters that have facial expressions and words attached to them just to remind you. And this is really important for kids as well, because for children with ADHD, they have big feelings and they don't have the capacity of the developed prefrontal cortex to help them rein them in. So that idea of containment is particularly difficult for kids with ADHD because the things that they need to contain them, those executive functioning skills, are not just weaker as they are for many people with ADHD, but they're also undeveloped. And that's like a double whammy. So what happens for these kids is their level of frustration increases. So now they have these feelings that are overwhelming them, and they have frustration because they can't manage them, or they have frustration because they don't know how to put words into them, or they have frustration because no one's really understanding what they're trying to express. And in all of these cases, the first step has to be to slow things down. And so in a calm moment at a family meeting or at dinner, or for you as an adult, maybe before you go to sleep at night, or if you're on a run, think about what are some ways when you notice that you feel that you're becoming activated, and what words could you put to that to buy yourself some time to slow it down. I'm not sure how to tell you what's going on. I need a minute. Or you know what? I'm a little overwhelmed right now. Give me a couple minutes and I'll get back to you. To slow it down and buy time. There's no shame in doing that. And so then if you are feeling shame, we have to deal with that shame directly. So let me go to Liz's question, when you're feeling hyper and you cannot calm down in an appropriate way. So when you're feeling hyper and you can't calm down, usually what's happened again is that the part of your brain, that prefrontal cortex that could help you slow down, that could help you, be more in sync with your situation, isn't really kicked into gear. And so then I would imagine, Liz, that what happens is people start to tell you that you're acting hyper or to calm down. And frankly, for me, when I'm upset and someone tells me to calm down, It's like I want to, it's like I want to scream even louder. Telling me to calm down is not going to help me calm down. And it's probably not going to help you calm down or kids with ADHD calm down. We need specific tools. And that's why we have to identify those tools not in an activated moment. So if you're feeling hyper and you need to calm down, but you can't do it in the minute, what are some things that you could rely on to remind yourself, I need to step outside. I'm going to listen to a song that helps me re-regulate and I'll come back to you. Or, I'm going to put my hand on my chest and breathe in that beautiful color so it goes all the way down to my toes and I can start to feel my feet on the ground. That's a very simple thing to do, which is to feel your feet in your shoes or on the ground. That's where we want to root. In yoga, when you're doing different poses, the instructor may say, root down to rise up. And that's what we want to think about here when we're expressing our feelings. We want to root down so we can open ourselves, open our language, and talk about what's going on. Cassandra, watching from North Carolina, and I've always struggled with emotional regulation. I feel even the smallest things in a big way, and it's always been a struggle to keep things in perspective and not let it all boil over. Right, Cassandra, that's exactly what I'm talking about. So in these moments, the moment before the boilage is what I want you to start to catch in yourself. Is there a feeling in your stomach? Is there a feeling in your fingers? Something that lets you know that you're starting to activate so that you can do an intervention in that moment. One of the problems with emotional regulation for people with ADHD is we begin to start to regulate once we're almost basically off the cliff. And there it's very difficult. It takes at least 12 to 15 minutes for your system to settle down once you've been fully activated with adrenaline. So we want to catch it earlier. What are things that trigger you? What are some responses when you're feeling triggered that would be different from what you're doing now? Susan says, I've been told I'm too sensitive by people close to me. Ouch, what do I do about that? I think that since we've talked about this when we've talked about rejection sensitivity disorder, I think a lot of people with ADHD feel things deeply and profoundly, and particularly those of us who struggle with emotional regulation. I have big feelings, and those big feelings are a source of joy for at times for myself and from the people around me, and they're a real sort of downer as well. And so the thing that I want to say is, yes, I'm sensitive. I'm super sensitive, Susan. And sometimes that sensitivity really serves me, and sometimes it's a challenge. Own it instead of feeling put down by it. When I grew up, my family used to tease me. And they would call me super sensitive Sharon. Like it was a bad thing to be sensitive. And I'm glad I'm sensitive. It makes me a much better psychologist, and it helps with my empathy in the world in general. Alethea, saying no to things I don't want to do but feel obligated or ashamed to do. Yes. So one of the things that's hard if we want to please others, particularly if we have a history of feeling less than, is we say yes. We say yes. I do this myself. I have a hard time saying no because I want to, serve people and assist them. And I have a lot of things that I like to do. And so I think that when we say no to things, we feel like we're shutting down opportunities, but we're also turning people off and that we're rejecting them. And there's a difference to saying no and actually because of your own personal limitations or things you can and cannot do and feeling freed by that versus saying yes and then feeling obligated, not being able to meet those obligations and being stressed out. So the challenge, of course, is differentiating, is choosing what is worth saying yes to and what is worth saying no to. And I wish I had the answer for you for that. I don't. I think it's a very personal thing. And I think it also has to do with, what your goals are for yourself in terms of work or social life or your family. Welcome, Lindsay from Canada. Michelle from Atlanta. Julie, nice to have you join us. Thanks. Watching my DD just gets overwhelmed with anxiety and goes with I hate you. Okay. So I think we have to talk about self-hate and emotional dysregulation. This is something that I see a lot of times and with a lot of clients, and I have to say that sometimes I feel this way myself. It's very hard to live in a world where other people seem to have it all together and they manage their feelings, and you have big feelings, and you kind of wear your feelings on your sleeve, right? That's something that a lot of people with ADHD tell me. Everyone tells me how I'm doing because I wear my feelings on my sleeve. So what I want to encourage you to do is to stop hating on yourself. Like, there are some benefits to being more of an open book. People don't have to guess as much. You don't have to basically struggle to show how you're feeling. It's there. The question is whether the boundaries we're going to create around it. So when we know it's safe to be more open, and when we know it's appropriate to be a little bit more boundaried. And I'm saying boundaried specifically instead of shut down, because I'm not advocating shut down. What I'm advocating is your hand on the knob of the intensity of your feelings. We want you to feel like you can turn them down and you can turn them up, rather than they're doing that to you. Welcome to Kathy and Elaine, and Jessica has a question. Sensory overload, being harsh or explosive. Right, so this is really important, Jessica, thanks for saying that. When we're overloaded, whether we're overwhelmed in a sensory way, whether we're overwhelmed cognitively because we can't process all the things that are going, whether we're overwhelmed emotionally because our kid is really hurting and they're sobbing about us being teased, whatever it is that's overwhelming you, the ADHD brain is going to need more time to process that. So you're going to have an initial reaction like, oh my God, whoever teased you, I want to go out and yell at them, or I want to yell at their parents. But that's actually not going to help the situation. What's going to help you is to first name and own your feelings. I'm really feeling upset. I'm angry about this. I don't like when my child is sad. I feel powerless. I want to protect them. I don't want them to experience pain, perhaps sometimes the way I did. This is the kind of language that we're talking about. And someone earlier, I think it was Ajit, said, I don't know what words to put to my feelings. You don't necessarily have to know what each feeling is with a word. You can know, I'm having big feelings, and I'm just gonna note that and maybe write down some of what's going on, and on a piece of paper jot down a few things, and then I'm going to come back to it and see how I can break it down. When we're flooded, we can't really break anything down. We have to use our physiological brain, our physiological being, our reptilian brain, to settle and slow ourselves so that our thinking brain can go online and kind of get that emotional brain into the back seat instead of the front seat where it's driving the car. So it's okay to say things, I'm overwhelmed. I don't know what's going on. I don't like that feeling. I'm overwhelmed. I'm afraid. That feels very uncomfortable for me. You can name the sensations without having a specific name for the feeling until the clarity sets in and your language is back online. A lot of times we can't name our feeling because our thinking brain is not active. Sometimes we don't know the words, and that's okay. Maybe you need a little education around that, or maybe you might benefit from some therapy to help you understand your feelings and put words to them. Chris just says reactive. Yes. So when that switch flips, right? And you just go right into reactivity mode. And that's the thing where I think most of us get in trouble. I've said many things to my kids in my perimenopausal years when they were teenagers that I wish I didn't say. And all I can do in those moments is, after it's happened, is own it. Be aware of it and try to change it. You can only say you're sorry so many times. So that's why we want to break it down. What are the signals that you're becoming reactive, and what's an immediate intervention you can do for yourself? If you need to go to the bathroom and just wash your face, wash your hands, talk to yourself in the mirror, breathe, even if there's chaos on the other side, you are getting in control of what's going on. D says, when impulsive, supporting, or remembering tools for self-regulating within my son personally and my own son. So what happens is that you don't remember the things that you know work for you. I'm sure you're not alone with this, D. And what I would encourage is to use your phone and put a note, you know, calm me down sayings or calm me down choices. I personally, you know, during those years that I just mentioned, I made an anger playlist, and there's songs that are going to help me sort of calm down. There might be songs that I want to play if I want to take a really fast walk and get it all out there. So you want to try to have resources that you have access to. If you want to do this with your son or daughter or somebody in your house who has ADHD, I encourage that. Maybe put it on a whiteboard up in the kitchen or a poster, you know, what you can do, what they can do, so that you can just say, let's check our posters. Harlan, when other people aren't open to other points of view, that's actually bigger than the actual topic. Yes. So one of the things that's really hard for people with ADHD, because you know we're creative, you're creative thinkers. You know, we can, being outside of the box is very comfortable. That when people are more narrowly structured, when they don't think outside of the box, it's very frustrating, and that can trigger a response of anger or over or reactivity that actually sets you back, but doesn't affect them at all. I think in situations when people aren't open-minded, the question is, what can you say to them to point out, you know, I'm frustrated, I'm trying to look at this from a different angle, and I notice that you're not. What's going on? Turn it back on the other person, not in an accusing way, but just in a curious way. Curiosity is our friend here. You know, when you're feeling emotionally dysregulated, instead of judging yourself and criticizing yourself for what's going on, try using curiosity. I wonder. Let's see, Charlie, being oversensitive to criticism as an adult. So we talked about this. So one of the things that we have to do is figure out, you know, what is our Teflon coat of armor that we're going to wear, and when do we wear it? When do we put on, you know, a suit of armor, I guess, not coat of armor, so we know that certain things, you know, we can listen to, but we don't have to take in. You know, it's one thing if someone's giving you feedback, you can write it down and then you can take it in later. The other thing is to acknowledge, is anything this person's saying have value to you? Is there some validity to it? The way they're delivering it may be terrible and it may be way too much, but if there's a kernel of truth in that, own that kernel, and their bluster will usually will kind of fade away, because you've said, you know what, I did do that. And I can see why that was hurtful. Rebecca, when my child can't manage anger, regardless of emotion prompting the anger, while trying to manage my own emotions. That's exactly right. And I talk about this in my book, What Your ADHD Child Wishes You Knew. It's the 5 C's. And I want to just review these for you right now. So the first one is self-control. We adults have to manage ourselves first so that we can assist our kids in managing themselves, so that we can moderate what's going on with our kids. If we're dysregulated, they're going to be dysregulated. And this is what kids have told me over and over again. You know, it's like, you know, when you're on, if you've ever flown on an airplane, they tell you to put the oxygen mask on yourself and then on your child, which seems counterintuitive. Of course, you want your child to breathe. You'll do anything for your child, even if you're not breathing. But if your child is breathing and you're falling apart, that's not going to help your child. So you put it on yourself super fast and then on them. So when your child cannot manage their emotion, what they're showing you is they don't have the tools and they don't have the skills for what they're experiencing right now. Your reactivity throws fuel on their fire. It's okay to say to them, wow, you know, I can see you're really upset. And actually, you're being upset, you know, it's a big upset. It affects everybody. But um, getting activated when they're already out of control is not going to help them. So that's when we have to understand what we're going to do. And I talk about the process called stop, think, act. I have I've written about it on my website, and it's definitely in my book. And what this is, you're going to cause a pause in the action. So before, in a not meltdown moment, you're going to talk about what we're going to do the next time a meltdown occurs. Because let's face it, meltdowns occur, they reoccur. They occur in different forms, different shapes, different times. So you want to have a process plan, not necessarily a content plan, because the content is going to shift. Different things are going to trigger kids with ADHD at different times. It's how you're going to respond to it. So we're going to call a pause in the action. And a pause in the action might mean we have to leave the grocery store right now because things are out of control and this isn't working. A pause in the action might be, you know, we're going to set the timer for 15 minutes. That's what we agree to. You can listen to music. You can pet your bunny. You can take out your calm me down box, which is filled with activities from the dollar store that are just for this moment. You can go up to your room and play with your Lego. We will come back together in 15 minutes because that's when the system calms down. And for younger kids, they might need to sit next to you and have a hug or hear a story, which could be very taxing for you, particularly if you're activated. So in those moments, what I want to encourage you to do is think of something that's going to help you get grounded. Maybe drink a big glass of water. Maybe do that trip to the bathroom. Maybe just open the door and breathe some fresh air and close it so that you can be available. Then we have think. And think is when you come together and you talk about what's happened and what you want to do next. What is the next right thing to do? Think is not a time for teaching a lesson. Think is what was going on, how we can move forward. That's it. Then later, at another time in the day, or maybe the next day, it's a time to replay what happened and talk about what you could do differently. So, okay, of course, thank you, Facebook. They have erased some of the comments, so I apologize for that. I'm going to move forward. Not thinking of the consequences of my words and then getting surprised when people get upset. Thank you, Charlie, for talking about this. So sometimes when we're activated, we don't see the effect of our emotions and our words on other people, or we see it, but we don't care because we're so upset, we just have to get the upset out. We can't hold on to it any longer. And so what I want to say to you is, other people's reaction is feedback. It's feedback about the size of your reaction and the effect of your reaction. And if people are yelling back at you, if someone is crying back at you, that's a good sign that you need a stop. Okay, you need a pause in the action so that you can come back and say what's going on in appropriate I statements. So let's talk about communication. So you may or may not know the very simple formula. I feel blank when you do blank because. That is the cleanest way for you to communicate what you're feeling in a moment. I feel you are is not a feeling. I feel that you annoy me, not a feeling. Feelings are sadness, joy, frustration, disappointment, hurt, fear. That kind of sort of covers the whole range, or maybe unsafe. So those are the feelings. And so you can say, I feel unsafe when you leave the car running in the driveway because I don't know if you're going to go back to the car or if you just forgot to turn it off. That's a clean statement. Okay, so I've lost some more comments. I'm really sorry. I know that One of the women from Canada had a comment, and of course it disappeared into the Facebook fog. So please, if I'm not responding to your comment, please submit it again. I'm very sorry. You're breathing sparkles in your class. I love that. Breathe in the sparkles, breathe out the sparkles, whatever, however that works. I don't know, Dee, please share. Claudia, so true. Rebecca, excellent point. The art of living has a great breathing technique. Terrific. Claudia, identify where you feel it in your body and validate your own feelings. Exactly. Instead of judging ourselves for having the feeling, we want to identify it and accept it. And then we'll be able to figure out what to do about it. Hi, Annalise. Nice to see you. Hi, Michelle. Welcome. Good to see you. D. Certs emotion picks are good for children, as is the zones of regulation and emotional talks. Yes. So we want to have, for a lot of kids, and if you're a teacher or an educator or in your home, get one of those posters which has like all these different expressions with the feelings underneath. And then that can help your child say, I feel. You turn to the poster. It might help you too. I feel, and you turn to the poster. It just keeps things cleaner, and that is the goal. Thank you, Rebecca. Thumbs up. Amy, let's see. How about attention-seeking behaviors even when they get enough attention in a 6 or 7-year-old? So 6 or 7-year-olds, as we know, because the ADHD brain develops more slowly, are with 3 years delay, could actually in some ways, particularly in emotional regulation, may be more like a 3 or 4-year-old. So when they're doing these attention-seeking behaviors, what actually is uncomfortable or insecure in them that they need your attention? And then how could they learn to self-soothe? Self-soothing is a lifelong skill, and while of course we cannot expect young children to do this all the time, we want to offer them some options about what to do. Doing a puzzle, doing Lego, jumping on the trampoline, running around through the living room 3 times, or putting your coat on and running around the house 3 times outside. Maybe doing some jumping jacks. We want them to figure out how, almost to distract themselves from what's going on so that they can settle, and then we can move forward. Use tools. How do you calm down? Claudia, if you're asking me how I calm down, okay, I'm feeling a little vulnerable here, but I'll share. So I promised myself in January 2020 that I would write 3 good things about every day at the end of each day. And this is to help me remember that things can go well, even if they're small things. I think the other day wasn't such a great day. One of the things that I wrote down was, I love my new sweater, because I love the color. And every time I went to the bathroom and I looked at it, I was like, I'm so happy. So that made me happy. Did I do it well? Who cared? It was something good in my day. So that helps me calm down, because I can remember or look back through my year and see that there are things that I do well or things that go well, and particularly in those moments when I feel crappy. When I'm activated in a moment, what the most important thing for me to do is actually to separate myself and breathe. I might do a little bit of yoga. I might take a walk around the park. I need to, basically do some kind of physical activity. And sometimes that's breathing, because I might be in a meeting and I can't do anything. I have my hand on my belly and I'm just noticing my belly go up and down. So I think that those are the things that I use the most. And honestly, sometimes I just need to get fresh air. I just open the door or I open the window and I breathe in, and that helps me settle. Mona, you usually walk away to pray. I love that. That's great. D, could be communication rather than attention seeking. Yeah, interesting point. Are they trying to communicate something to you rather than seek your attention? or that they can't manage. So a lot of times kids can't manage the big feelings that they have, and they want you, their parent or their caring adult, to take care of it for them, to make it better for them. And well, of course we want to comfort our kids. We also want them to learn how to self-soothe. So what are some things that help them calm down? One thing that I think it can help are, maybe they like to color. Coloring is also very soothing. Maybe they like to play the drums, something that actually can help them get some of those feelings out, but also shift their brain away from being overwhelmed by feeling to actually doing something that's nurturing. You're welcome, Claudia. Rebecca, breathing techniques, positive self-talk, removing yourself from the situation. Good luck. Still working on it. Well, Rebecca, that's the thing, right? So, these are things I've been working on most of my adult life. I presume that I will be working on these for the rest of my adult life. So my goal isn't perfection. My goal is steadiness. Am I doing this? Sometimes. That's better than no times. Do I expect myself to bomb sometimes? You bet. Do I expect myself to, succeed sometimes? Yes. I think I'm better at doing that than I was before, but it's not perfect. And that's the thing I think about, is not expecting perfection from yourself. Do you use your breathing technique sometime? Okay. Do you tell yourself something positive sometimes? Okay. Can you take a break from the situation? Okay, great. Those are 3 tools that you're able to use. And if you use them sometimes, that's better than never. Charlie, what techniques could you suggest to calm down if you cannot step away? E.g., if you are parenting or in a situation where it is not appropriate to step away. Yes. Okay. So in those moments, what's important to do is for you to actually try to direct yourself away from your feelings to the situation at hand. And instead of, how can I manage this? Oh my God. I want you to think this one question. What is the next right thing we need to do here? That's it. What is the very next step? When we shrink it down to that level, the chances of you actually being able to do that and show up in that way are much greater. So if you cannot step away and you need to calm down, ask yourself, what is the next right thing to do here? You can also ask yourself another super important question, which is, what is my goal? What is my goal in this situation? And that might help you slow it down. Otherwise, I would actually just really focus on breathing. You could do that alternate nostril breathing, not necessarily in a meeting, but if you're parenting a kid who's losing it, that's something that you could do. You could put your hand on your chest, as we did in the beginning of this session, and breathe in a few times just to kind of give yourself a hug and reassure yourself that you can handle this. And I would consider, really opening up your heart and loving on your kid. When your kids are this dysregulated, they are very, very uncomfortable. It feels terrible. Think about when you're yelling and screaming. It feels terrible. And they don't have the resources, the internal resources yet to manage that. So in some ways what they need is to feel loved and connected with. I think in many ways what they need. So how could you do that? And maybe talk about that in a calm moment and apply it at that time. Kari says, hard for me to self-regulate at work when my fight or flight reaction is fight. Yeah, okay. So that is a very strong reaction many of us have, is that strong fight, like, I'm not going to take that, and don't talk to me that way, and you're wrong. But that's usually not going to get you what you want. So that would be a good time to maybe have a fidget in your hand, or to maybe take, look like you're taking some notes, but write down what you would really like to be saying. I think that often what happens is when you want to fight something at work, it's because there's some perception of injustice. And in those moments, what I would really encourage you to think about is, what is my goal? Or what is the next right thing for me to do? There are ways to reflect your dissatisfaction with what's going on by saying, I notice, I observe, it seems to me. Those are less provocative. Then you can go in your office and call your friend and tell them what a jerk so-and-so is. Dina, when I get really angry, I can't express it without falling apart and crying. This happens for a lot of women, actually. When we get very emotional, we start to cry and we fall apart. And the thing is, it's like we're sort of collapsing. And there's nothing wrong with that. But it may not actually be serving you in a way, because when you're collapsing, you may be telling yourself, I'm weak, I can't manage things, what's wrong with me? When you're really angry, the thing that happens is it's okay to have a little cry if you need to, if you're in a place where you can do that. If you can't, write down, or take a moment and write down, what you're feeling, what your big feeling is. And I encourage you to find a point in the room and look at that point and breathe to that point, so that you're focused on something outside of you. Maybe it's the window, maybe it's the stapler, to bring yourself down and to have a phrase that you can say to yourself in that moment. I'm angry, I'm upset, I don't want to cry, I'm going to breathe instead. And then when you have some safety, you could cry. If you have a space to cry and be upset, go cry and be upset until it's all out of you, and then you'll be able to regroup. Just don't judge yourself for it. Julie, how do you handle school struggles around being frustrated and having big reactions, not knowing how to handle it in a school setting, not being able to be flexible and go with the flow? That's a great question. So I'm guessing this is for a child, but if it's for you, Julie, let me know. If this is for a child, I think it's very important to have in their accommodation plan the option for them to go to the nurse, or sometimes, sit in the principal's office and talk to the administrative assistant, to have a place where they can go to regroup. When kids are frustrated and angry, not having a plan means they're going to act it out in class. So they need to have a free pass sometimes, and maybe they get one free pass a day where they can use that. But to come up with a plan with the teacher and the administration, what are you going to do in moments when you're frustrated? Do you have the adequate fidgets? Can you go to the quiet corner and read a book? What are the acceptable options? And then write those down, and if you have a desk, put it on the desk so the teacher can say, check your list. Claudia, yes, you can see it on my face. I'm the same way. You can see my feelings on my face. And I don't have a poker face at all. I don't even know how to play poker because I don't have a poker face. So in those moments, I just am honest, I say, yeah, this is a little distressing for me. Boom, I've named it. And then I'm not, having to deal with the anxiety about having the feeling and managing the feeling. Sometimes the anxiety about having the feeling is what makes it hard for us to actually manage the feeling. Claudia, try breathing exercises from the Art of Living. Yes, and I would also encourage you to try Headspace or Insight Timer. They have wonderful, wonderful short meditations and where you can learn how to be comfortable with your breathing. There was one that I did this week, which was when you breathe in, you say, you breathe in calm, you breathe out ease. Maybe those words work for you, maybe they don't. Come up with your own. D, validating my son's big feelings really help. Yes, because what we want to do is mirror and empathize what's going on with our kids instead of, telling them to stop or dismissing what they're feeling. Those dismissals or that minimization really makes them angry, and they just will have a bigger reaction to it. You're welcome, Ajit. Mona, I mostly feel I should just stay quiet and keep to myself so no one would take advantage of me, especially in a relationship. We are all prey to some very evil people out there. Yes, there are plenty of people who can take advantage of you, and there are plenty of people who love you and care about you. And so one of the challenges is to learn who's safe and who's not. It's probably not safe when you're at work to share your big feelings about the promotion you didn't get. but it's perfectly fine to go into your car at lunch and call your partner or your parent or a friend or a sibling and have a little cry. That's okay. That's what we want to learn. When, where, how are we expressing our feelings? D is replying to Rebecca, trying to slow down to do this. I so hard giving ADHD. My kids do too, my poor hubby. That's his journey, right? And how lucky for him, he lives in a house of super energetic, creative, out-of-the-box thinkers. Okay, thank you, Renee. And I'm going to wrap it up soon. Oh my gosh, that time went by so quickly. Claudia, sometimes after an exchange or an argument, I don't even know what happened or what was said or why. Right, and that's because your amygdala is taken over and your thinking brain, is basically checked out. Now, there's been research on the connection between working memory and emotional control. And actually, people who have strong working memory often have better emotional control. And a lot of people with ADHD struggle with their working memory. So, and we all have degrees of emotional control and or lack thereof. So, so what I want to say is that if you have an argument and you don't even remember what you're saying, then you've definitely gone over the cliff. And so you want to, as soon as you're both yelling at each other in an argument, that's when if you can't call the timeout before that, then that's a signal. We're both yelling. I'm calling a timeout. You can say, have a keyword like dinosaur or, time apart. I prefer time apart to time out. I think of time out in terms of sports, but in terms of managing big emotions and stop, think, act, I call it a time apart. You take a time apart and then you come back together. Benjamin, my in-laws think that it's my fault that my child is not listening. She doesn't understand ADHD. Well, give them some reading material or have them go to a website like Attitude or my own website if I have to be shamelessly self-promoting and check it out. Learn. The onus is on them to learn about ADHD, not on, on your daughter or to teach them for sure. Claudia, it's not your fault. Also, I'm an adult with ADD, a college grad and teacher. Your son will be successful. Amen. That's totally true. Similar struggles. My child can't listen. It's not bad behavior. He can't help it. That's right. And so I think if you're, for extended family members or even grandparents or maybe some siblings, we want to educate them about ADHD and we want to educate them about executive functioning skills. And this will be my last comment. We all have executive functioning strengths and challenges. The difference is that people who have ADHD or who may be on the spectrum or have learning disabilities often have executive functioning challenges or weaknesses that are more intense or more severe and outnumber the strengths. And so it's an imbalance. And so we want to help, we want to sort of lean into the strengths that exist and try to shore up some of those challenges as best we can. And that's true for all of us. And I think that's really important to convey because it normalizes the executive functioning challenges that people have with ADHD since we all have them. Thank you so much for joining me today. This was a wonderful conversation. I really am thrilled with all of your participation and I'm grateful for it. Please join me next week at 4 p.m. for our next Attitude Live. And please check out my website and my new upcoming masterclass, www.drsharonsaline.com. Check out my Facebook too. There's some videos there you might really like. Have a beautiful rest of your day and a lovely weekend. Thank you.